coverage of the 2022 Ontario election right here in Haliburton-Kawartha Lakes Brock. This is Your Vote on Your TV, and I'm your host, Zach Miller. We are joined by the Liberal Party of Ontario candidate, Don McBey, for Haliburton-Kawartha Lakes Brock. Thanks, Don, for joining us here today.
Thank you very much for having me.
Yeah, so this is your first time, like many candidates in the race, running for political office and running a political campaign. And it can definitely be a little challenging getting your name out there, meeting voters. So here's your opportunity right now, at the beginning of this interview, to kind of tell voters who is Don McBey.
So, I see myself as a very pragmatic, centrist politician in the political sense. Of course, as you say, I haven't run for political office in Ontario. Back in my student days, I actually did some work for the Liberal SDP Alliance and stood in a local election when I was doing graduate law work over there. Really, I think there are a number of things that are important to me. First of all, sensible, rational policies and approaches to policies. Very much an objectivity as a mediator and as somebody who's been an administrative judge. It's important to get the facts and hear voices on both sides, and then to come to the best possible solutions. So that is something that I think I will carry forward from my working life into hopefully my new political life.
And what made you want to run for the Liberal Party in this election?
Well, it was reflection. I guess a lot of people in the last while with COVID shutdowns and so forth, I guess looked at what they were doing, made choices. A lot of people, of course, have come up into the Kawarthas who were otherwise just seasonal residents and now want to be permanent residents. And I think that reflection pointed me towards some of the things that I hadn't gone through and hadn't done. But would have liked to have done. And one of those was running for political office and trying to make, I guess, the opportunity to empower the local people and local institutions on the provincial level, because otherwise, as a private citizen, that's not something that you can really do except working through the local institutions. So I think that more than anything else, looking at what has happened with the Ford government, the cut and slash economic policies in education and healthcare, and just the conundrum that we have now with healthcare professionals leaving the profession, and really a crisis in care for seniors and also for people whose healthcare has essentially been put on hold through the pandemic. So these are really critical issues that I think I'd like to address.
And how do you propose to address those issues and change? And thinking back, there was 15 years of Liberal government. Is it going to be the exact same as that government? Or do you plan to kind of revolutionize the party here going forward?
Yeah, I think the party is, whether it's revolutionized or what you want to call it, but essentially there was a huge changeover at the last election because people didn't like what they saw. There are a few issues that really stuck in people's craw, and they threw out a lot of the existing sort of Liberal apparatus at that point. So I think the one other issue is that right now, those of us who are standing for the Liberal Party are standing for a new party. We're coming in, we're bringing the talents that we have, the experience that we have, to really bring a new viewpoint as to what government can do. And a lot of that has to do with responding and empowering people on a local level and making sure that the average person is heard and that those issues are actually addressed on the provincial level.
And are you hearing that at the doors right now about people seeing a new party coming forward in the 2022 election versus what they saw in the 2018?
Well, I'm not hearing much of the sort of looking backwards into the past. I think people realize that there was a change. So no, I haven't had very much on the doorstep in terms of saying, well, were you doing in the win years? I would say, well, no, I was in public service, so I couldn't do any overt political activity because that's prohibited. When you're a public servant, you have to be strictly neutral, you do your job, and you do it to the best of your ability.
So you just mentioned you were in the civil service, so what kind of job did you have there, and how does that translate over holding political office?
Yeah, so there are two careers that I've had. One is as an administrative lawyer dealing with workplace health and safety, and the other is as an ordained minister and a therapeutic counselor. So both of them have aspects of healthcare and personal care. The public service was a post as an administrative judge. It's called a vice chair of the Workplace Safety and Insurance Appeals Tribunal. We were the highest level of appeal in that system for worker benefits, people injured on the job. So again, there it was a question of being very fact-based, being very caring in terms of the very human situations that were before us, and also being very knowledgeable about the medical situation and open to looking for anomalies and also for clues as to what was actually going on in terms of the administration of law. So in other words, we were dealing with an act not from the legislative point of view, but the application of the law to actually circumstances in people's lives that actually made quite a huge difference in some cases.
Yeah, and so you were on that work and health safety wise, right, our board that you just mentioned. So is healthcare one of your key issues that you're really pushing for when you are talking to voters in this election?
Absolutely. Healthcare and long-term care, they both, I think, go together. The Ford government's plan to throw money into further institutionalizing the care of our seniors just does not make any sense. We've found out, through this last pandemic period that people were trapped, people were isolated, people died, but also the people that survived had their lives really torn apart, and the families torn apart as well. So the model that the Liberals have proposed, and I'm very happy to represent that, is to go to an in-home care model. Nobody wants to go to one of these institutions unless they absolutely have to. People want to remain in their homes, to have dignity, to have independence to the extent that they can, and to be safe. And that's where the money should be going, and that's what we're also putting forward in our platform.
And so when we do talk about long-term care versus home care, the Ford government just gave licenses to a bunch of facilities and corporations. So how does the Liberal government plan to counter that when these licenses are 30, 40 years long, and now we need to move over to a home care model?
Yeah, licenses are licenses and legislation is legislation. If we go to a model that's legislated through the question is whether there'd be any vested rights that would take, have to be dealt with, but that would be a legal question. But there's no doubt that the legislature has the power to change the model, regardless of any of these deals or licenses that the Ford government has put out.
And does the Liberal Party and yourself recognize the importance of staffing levels and the nurses and PSWs that go into this? Because we don't have a real large home care system now, and it's going to need a lot of money and a lot of time going forward.
Absolutely, and what I've seen firsthand in dealing with these files, and I still do consulting in that area, and largely for healthcare and hospital facilities. You're getting so many PSWs, registered practical nurses and so forth, who might have had a minor injury, say a strain or something like that. They're not coming back. They are just so stressed out that they're leaving the profession. So that is a huge crisis. It's already started. It's going to get worse, and we have to address that by ramping up the training and the hiring of healthcare professionals across the board to make sure that we can actually adequately staff and ensure the levels of services, especially in rural communities. I mean, the Conservatives are trying to really fragment a lot of the healthcare in these rural constituencies. Doug Ford seems to be, taking the point of view that everywhere outside of Toronto is just like a Toronto suburb, and you should go to a big hospital, and get all your care at one big hospital rather than in a local facility. Well, that just doesn't work out here, and he's not hearing that message. So the staffing levels, but also staffing levels regionally adjusted so that we make sure that not all the staff is going to go to the big cities and so forth, that they're actually coming out to hospitals like Ross Memorial, like the Haliburton and Minden hospitals, so that people can actually access services close to their home.
And you say Doug Ford isn't hearing people in rural ridings like Haliburton-Kawartha, Lakes Brock. What is your strategy going forward in the next 30, 31 days to get people to listen to you and to advocate for them?
Well, I don't have to do that because I'm listening to them saying that. I'm listening to Conservative voters on the doorstep saying, I voted Conservative all my life, but I've heard about this Laurie Scott bill, PR 65, to take the community voice off of the Ross Memorial Hospital board. And they know the plan to amalgamate that didn't go through because of the public opposition a few years ago. They know what's happening, and they're bringing that up. The Conservative voters themselves are bringing that up and saying that maybe this is the time I'm going to have to change my vote to Liberal.
And that's the reception you're getting at the door is very welcoming, very concerned, right?
People are talking about that issue all the time. It's a big issue.
And going forward, it's changing that traditional blue riding that everyone so often counts us out.
Well, we'll have to see on the voting day. But what I'm hearing back is that there's a conversation and an openness to a conversation there, and how that issue fits into political, leanings in really right across the riding.
Yeah, and we spoke a little bit about healthcare. Is there any other maybe two policies or two big policy planks that you are campaigning on that you want voters to know about?
Well, there's so many sensible things that are coming out in the Liberal platform. Some of the things aren't out yet. The housing, of course, is a big thing. I think affordability for housing. We're going to have to wait for that actual announcement, but we have to take care of people who want to buy their own homes as opposed to being investors in the residential housing market, because I think things are getting too far skewed by the investors as opposed to people actually wanting to buy their own home. So personally, that's an issue that's close to my heart. Also education, to bring the class sizes down to 20 in a class. We're not through COVID yet. We need to put the money, to get the money to fund ventilation retrofits in these places so that students are safe, so that students, parents and teachers are all safe. And can go forward with their education with that confidence.
Yeah, so with the final thoughts we're almost out of time here. Mm-hmm. So what is something that you want voters to know specifically about you, to trust you going forward, to earn your vote?
So professionally, I've always been a listener. As a therapeutic counselor, the skill is to listen to people and to reflect back to them the views that they're expressing, and to try and empower them to come to solutions that make sense for them. In political life, it's, I presume, somewhat different because we have to take this to a legislature and do it in a fairly formal way. But the same skills, I think, are the ones that people are looking for. They want somebody that empathizes with them, that listens to them, and takes what they say seriously, and brings that into the political realm and transforms that into meaningful policy changes that affect their lives.
Yeah, exactly, and reaching out to them is definitely one of the ways to do that. So just very quickly, strategically wise, knocking on doors, is that one of your big?
Well, these days it's the whole gamut. So knocking on doors, social media, but yeah, it's voter contact, person-to-person contact. It's that, empathy. 2 to 5 minutes that can change a vote and also change a political landscape.
Exactly. Well, thank you so much for joining us today, Don. So that was Don McBey, the Liberal Party candidate for Haliburton-Kawartha Lakes Brock in this 2022 provincial election. And that wraps up our candidate interviews for your vote on your TV. Thank you so much.